Good day to everyone and welcome to the ITPC webinar, Making Sense of the Madness, Understanding the Current Crisis and Opportunity in Global Public Health. I'm going to wait one more moment for folks who have not joined exactly on the hour, and then we will kick off. Thank you. Good day, everyone. Thank you for joining us from across the globe. My name is Krista Lauer, and I am the Citizen Science Lead at ITPC. I'm honored to facilitate today's discussion. We're here to make sense of the madness, what's happening in global health, not just in isolation, but in the broader context of shifting power dynamics, funding vulnerabilities, and the fight for health equity. Before we kick off, just a few quick housekeeping items. Our session today is in webinar format, so please introduce yourselves in the chat. You can mention your name, the organization, and the country where you're based. Second, there's no translation today from English to any other language, but we are being recorded so that we can work on translation and wider dissemination on our YouTube channel in the coming days. Finally, we will be using the Q&A function. You can find it at the bottom of your screen to field questions throughout our time together. So our team is standing by to review and consolidate as many questions as possible, which we'll pass along during the panel discussion. In addition, raised hands, we would prefer if you could put questions into the Q&A box so that the panelists can also respond in writing as we go along. And we do really want to hear from you. Next slide, please. So I just want to start by acknowledging that these are very unprecedented and uncertain times. And for many of us, we're reeling from unforeseen risks to our health, to our communities, to our loved ones, to our jobs, to the global health system that we've spent our lives building. And thank you for being with us today as we navigate these waters. So in today's session, this is what we're going to get up to. We're going to get aligned on where we're at, what we know, what we don't know, what it means. We're going to hear from key thought leaders about the deeper implications of these shifts. And we're going to discuss some strategies to stay focused, resilient, and effective. And remember, don't panic, organize. Let's jump right in. So I just wanted to briefly flash this run of show. We're going to start with a flash briefing, an update on where we're at today. We'll have some opening remarks by our executive director, and then we'll get right into the panel discussion. There will be facilitated questions, but again, please use that Q&A function to get your questions out there. We're going to round up and close in a tight 60 minutes, so I am going to keep us to time, and we'll move quickly along. Next slide, please. Let me begin with a flash briefing. Of course, things are being updated moment to moment. This is really not meant to be an exhaustive update. And at the end of this section, we do have links to further reading. Next slide, please. So as many of you know, on day one of taking office, President Donald Trump signed an executive order that banned any new government spending on foreign aid projects. But what was unexpected was a stop work order that was issued on January 24th, which means that funding to existing grants and contracts is frozen, which means even if an organization had money from the US government sitting in their bank account with a plan to implement it, suddenly they were told to pause. And there was mass confusion as implementers waited to hear which programs might be affected. Next slide, please. And sure enough, PEPFAR, the President's Emergency Plan for AIDS Relief, the single largest funder of the global HIV response, was halted, and that included disbursements of HIV medication. Advocates immediately started organizing, and this is just one example of a brief that was put together by AMFAR, and it's very clear that more than 20 million people who depended on PEPFAR for access to their antiretrovirals were at risk. Next slide. Shortly thereafter, 4 days later, a waiver was granted on HIV medication, but it was incredibly vague. The entire brief was very short and not incredibly clear. In the meantime, to add to this confusion, health service providers, NGO implementers, and civil society groups kept receiving stop work orders as communication trickled down from headquarters. Next slide. On February 1st, a further waiver was issued with a little bit more detail, but there are some huge weaknesses. First of all, it's very limited in scope. You can see from the table, only very narrow parts of the HIV response are allowed. And the details were vague, but communicated in very, very strict terms. So you can see from the red writing, any other activities not specifically mentioned in this guidance may not be resumed without express approval. And I do have to stress the entire memo is only 3 pages long. You can see a picture of the memo itself in the tweet that was shared by US Senator Bill Cassidy, who notably is a Republican, but did indicate he is very concerned that drugs are still being held at clinics and this needs to be reversed immediately. So why are the drugs being held at clinics if a waiver has been issued? Next slide, please. Part of it is a total lack of communication. There's confusion on all sides. And part of that is because top government staff at USAID were summarily being taken out step by step. So the first wave began on January 27th when the top USAID career staff were placed on immediate leave. One article from Politico said, "This is like taking out all the generals." The next day, nearly 400 USAID contract employees were laid off. This is significant because these are certainly the people who normally would be helping with communication and letting implementers know what is really going on. Next slide. This week, USAID has been shuttered and has become part of the US State Department. The USAID website has been taken down and USAID's profile on Twitter or X was deleted. Notably, Elon Musk sent messages over Twitter or X saying, "We spent the weekend feeding USAID into the wood chipper, and also USAID is a criminal organization." And as you can see, as of last night, when I made these slides, there was an update in Politico that Trump is moving to put nearly all USAID Washington staff on leave, and we've heard various other updates in community organizing networks about staff being recalled from posts in country. Next slide. The administration's response, again, at least as of last night when I was finishing these slides, Secretary of State Marco Rubio indicated, "I've issued a blanket waiver and I don't know how much more clear we can be than that." And I would say if some organization is receiving funds from the United States and does not know how to apply a waiver, then I have real questions about the competence of that organization. So as you can see, implementing organizations who are swirled in chaos at the moment are also potentially being scapegoated in future by leadership indicating maybe that means that they're not a competent organization. Next slide, please. Again, this is very much only scratching the surface. We just wanted to do a flash briefing to bring everyone up to speed. There are many, many other situations and programs and events that have happened that I haven't been able to touch on. So here are some links to places where we encourage you to read up on the situation. These are reliable sources that are publishing useful information and data. We're going to be diving into our panel discussion shortly, but first we're going to begin with a brief opening presentation by ITPC's Executive Director, Solange Baptiste. Solange, over to you.
Thank you very much, Krista. And with 2 minutes to spare, which is super helpful, it's great to be here, everyone, and to see you all. It's good to be with friends. I think in such a deeply traumatic time. I've often spoken to many people saying, "How are you doing?" And it's really akin to actual trauma. So really happy to see all of you on, and really thank you, Krista, for grounding us in the facts and where we are today. It seems like when you blink, something may have changed, and I'm sure there's an update that has not been able to be put into the slides. But it's really important to have clarity in times like this where there is so much chaos. The clarity gives us power, and when the world feels chaotic, it's easy to react rather than to reflect. And what would like to do before we open up to hear from our panel is just to share a few reflections with you as we go to try to make sense of it all. So next slide. I really just want to remind us that the chaos is a tool. So in as much as you use a spoon to get soup to your mouth, the tool here is actually chaos. It has a purpose. And if you look at the next slide, the the chaos and the crisis is being used to push through radical changes. And this is coming from Naomi Klein's shock doctrine, and this is adapted from Jennifer Walter, who's gotten a lot of social media presence these days. I will encourage you to listen to her podcast. All the links are in the website. So this is not original thought, but it's things that we are thinking about as we try to make sense of it. So while I think about this kind of like when you have a child that needs to get an injection, or you're trying to, you distract them so that you can do this other thing. And so the chaos here is sort of a distraction so that people are so disoriented, they cannot effectively resist. So the politics is not as usual. It's actually strategic exploitation of cognitive limits. Next slide. So when faced with overload, we don't rise, we shut down. So this is all very strategic. And this is, if you look at numbness theory, next slide. So when we have this information overload, we become more passive, we become a bit disengaged. It's too much, I don't even know, I can't today. It's some of the feelings that we have, and it's near impossible for citizens and the media to thoroughly analyze a piece, one single policy. And there has been a bombardment of all these executive orders, and one lawyer says it's not legal, one says it might be legal, and we're not sure. We're in a very obscure space, so we'll have to figure it out, wait till tomorrow, and we come back to even more confusion. Next slide. So when these multiple major policies compete for our attention simultaneously, what you have is reality and the agenda, and then the perception of our reality is then done by the media for us. It tells us how to think about a thing. They select and they omit and they frame the stories in particular ways. If you listen to certain media, you will hear a completely different story from certain other media. So it fragments public discourse, and the result is a weakened democratic oversight and reduced public engagement, but maybe not on our watch. So my next slide is really the question, what has been the response, and what has been the response from leaders? So here is a little bit tiny, but just look at the red arrows, and we're focusing on the gray bars, right? Who are the top receivers of US foreign aid in 2023? And you'll see that there are many African countries. The top one there being Ukraine, but the rest of them are many African countries. So let's just see what the next slide. We've heard from Kenya. So we had Kenyatta saying, stop complaining, it's time to use our own resources for the right things. He says the bullets and the cars and all the corrupt things have cost money, so we should be able to use our own resources. Then you have President Ruto saying that they're going to lose a lot of money, but he's a very more diplomatic answer saying that the relationship between the US and Kenya is special, and the United States is a blessing to our nation, and we work together in many aspects. So much more diplomatic, not sure where they will land. Next. South Africa, we having a more diplomatic answer in the middle, where we're saying we look forward to engaging with the Trump administration, bilateral interest, better common understanding over these matters. But then you also have President Ramaphosa saying we won't engage Trump with a begging bowl. And then you see Elon Musk meeting with Trump talking about we are constitutionally embedded with the value of respect of law and justice. So we'll see where they land. And then the next slide. In Botswana, thank you very much, US government. We will take care of our people. Next slide. So the question is this crisis also an opportunity, not just this tactic that's being used by the other side? And I would say yes. Next slide. We will explore that question that we have here. How does one country or one person or one small group bankroll an entire whole global system? Leaving us all vulnerable to their whims. And what can we do about that? So the next slide puts forward an opportunity, something that we can discuss in the coming conversation around global public investment, where collectively everyone contributes, everyone benefits, and everyone decides. This was also spoken about by the previous former Prime Minister of New Zealand, Helen Clark, saying we still haven't worked it out, but GPI approach is the best bet for modernizing international public finance. And so we have someone on our panel who can speak to this well today. Next slide, and then I think I will be done. So the themes to explore, these are too many words on the slide, but just looking at the red bits, there are lots of things for us to think about in the long haul. Erosion of multilateralism, sort of in the era of the oligarch, yeah? Dependence on major donors, the need for decentralized leadership, a call for resilience, the systemic inequities and the need for global power recalibration. So these are some of the things we're hoping to explore here today. We encourage you to put your questions in the Q&A box. And then the next slide, I think, is us moving to our panelists. So our esteemed panelists, their resumes are too long for me to, maybe you guys can start putting on your cameras as you like. And if you're not in a noisy spot, you can turn on your audio as well. But their resumes are all too long. So I've put just like literally 2 lines here, but would love to welcome Linda-Gail Bekker, Allan Maleche, Veriana Turto, and Harpinder Kolakot. Unfortunately, Greg is unable to be with us today because of a family emergency, but we will move on, and this is being recorded, so he'll be able to join us soon on that. So we're going to go into our panel discussion. So maybe we can remove the panel discussion slide so folks can see faces. And here we are. So thank you guys for all coming. So where do we start? I wanted to start probably closer to HIV before we move to wider health, because I think that's what's on everyone's mind, because of the direct implications of the PEPFAR program and then USAID as we understand it. So I just came from the global target setting meeting with UNAIDS and listening to the deputy director say that when we set our targets, we're not setting them for the US to fund them, it's for the globe. So on one hand, you know that HIV is a very moralized disease, and we know that governments don't always take care of all their populations. And so this is the space that often the US government and sometimes the aid has stepped in. So what would you say to those who argue that the global response to HIV has always been vulnerable to these ideological shifts? And what does this moment reveal to us about how fragile or resilient the progress that we've made truly is? And maybe we could start off with Linda-Gail. Now, this is a question to the entire panel. If you feel like you want to answer this, feel free to jump in. I have a second question and I'll ask you targeted ones. Thanks.
Yeah, thanks, Solange. And I want to thank Krista too. I think that was just a brilliant introduction to where we are, and sobering, but at the same time, I think energizing, because, I think there's a call to action in there that it needs to be heard and heeded by all of us. Your question is spot on. I over the years, I've given a talk around AIDS. Was political, is political, probably will be political forever. And there's no doubt that this is what makes our task so much more tricky and challenging, is that politicization can absolutely derail what we're trying to do. Now, I'm a simple clinician, a research scientist. My go-to here is always to go back to the evidence-based facts, and really ground all our responses, our actions, our responses to those ideologies and political statements, those emotions, on an absolutely scientific grounding. And that's become more tricky, right? Because information's coming to us, as you say, from everywhere, and it's sometimes quite hard to figure out what is in fact factual, what is scientific, what can be believed. But I would say that this is really where we as a community, and when we guide others, we send them to trusted sources, and we ourselves really ground ourselves in the facts and the truth. So, for example, when we have had to speak out about criminalization of same-sex activities, which is such an important public health issue, because we know that if we need to reach individuals, we need those individuals to feel safe to come to our services. We need to be able to reach out to those folk. And it's important then, in my opinion, to come against that pushback by saying, here are the facts. This is what we know. We can show you data that supports what we're trying to do. There is also evidence about other aspects that are women's health that are being eroded at the moment. And again, there's solid evidence that we can use to support the strategies we take. So that is one, perhaps not the only, but certainly one important tip, is to stay grounded in the science and the evidence.
Thanks so very much. Agreed. Maybe one more comment on this, and then I think what I'll do is go to specific questions and then end with the general one. So anybody else has a comment on this particular point? Okay, so I think it's really interesting there, Linda-Gail, to pick up on exactly what you said, because if we listened to Rubio last night and I listened to other news media that speak, there is, data doesn't always change people's opinions. I can give you more and more data, but it's an ideological issue. So good, you did a randomized control trial and it's in the Lancet, wonderful. But I don't agree, and so I will do what my base says, and so this becomes a political issue. So my question is, how do you safeguard science-based decision-making in an era where it is challenged and politicized and deprioritized? Because I don't know if we gave Trump more data, it would change anything. Sorry for the hard questions.
Yeah, no, and it's a tricky question. I'm actually going to raise a point because I think it's an important one, and it's, you know, it's around the sort of concept of pro-choice and you know, allowing women to make decisions about what they will do with their reproductive choices. Now, there's actually excellent evidence to show that safe abortion practices are cost effective. They're cost effective. It's not just that, you know, women's lives are saved or whatever, but the fiscus saves money by doing this. So I wonder if some of our strategy needs to be, the Archbishop always used to say, don't speak louder, change your argument. Maybe it's positioning this scientific evidence in a different way, in a way that may appeal, in a way that speaks to the individual who doesn't want to hear what you're saying. Because, you know, at the end of the day, I think what we must never do is gag science and truth and evidence. And I think it's really important that we lead with the science, particularly when it has public health benefit. And if it isn't being heard in a particular way, maybe there is another way that we can position it so that it, you know, knowing the audience, what appeals to that audience, and what might move the needle for them. And I'm wagering that maybe this administration, it may be around a fiscal aspect. It may be entirely ideological, and maybe then the idea is to go to some other you know, person who may be able to move a needle. So I think we do have to have a range of strategies. This is probably one of the hardest, and we lived through it during the COVID era. And, you know, I think we continue to have to think through ways to beat this one. Yeah.
Thank you. And that's really lots of quotable things in there. Maybe it just move now to Allan. So, you know, Linda-Gail was making the point that, you know, we could sometimes make a financial argument, perhaps, but as a human rights activist and as a lawyer, I'm sure you would agree that global health funding shifts are not just financial, right? They have profound human implications, as we were just discussing. So what are the legal and advocacy strategies that can be used to ensure that the most marginalized communities don't become collateral damage in the political and economic battles?
Thanks, and to build up on what Linda-Gail mentioned, the moral, the science, the politics, it's all linked to the legal and human rights obligation. But our starting point is that everyone is a human being and everyone has certain rights that they are guaranteed based on either documents the government signs, either documents global governments have signed and agreed upon. And so if you look at the situation facing us at hand, where we've had a pause to provision of treatment services, access to ARVs, waivers that have changed within the hours and not well communicated, it begs the point around the moral responsibility of, in this case, the US government, in terms of them having made a commitment over the years to say that they will put money aside to save the lives of people who are living with HIV and trying to get people to prevent from having HIV, and then going to a point of immediately stopping to do that, that raises a moral and a human rights questions in the context that you already made commitments to the world. You made commitments through your legislation to say that you will continue to provide this life-saving treatment, but then you make an abrupt decision that then makes the lives of people at a risk of getting treatment, the lives of women who are pregnant to lose the chance and the ability to safeguard their children from getting HIV. So I think there's an important conversation to happen there, whether you believe in science, whether you believe in politics, but there's a question to understand, even if you want to realign your funding, why take a very abrupt measure that has got life-changing consequences? And I think for me, the administration may not have thought through the consequences, and that's why we are seeing various waivers coming through, because they realize some of these things are not sustainable. You can't pull away nutritional food from a breastfeeding mother who's in a refugee camp on the basis that you want to check whether the money is actually being used and fit for purpose. So there's one conversation there that we need to ask ourselves, that when global governments, be it the US, be it the UK, be it anyone who pledges to say they're going to put money aside and they're going to do it for a period of time, how then do we hold them accountable when they walk away from that promise? And I think that's the question we're grappling with now. Are we going to look to our US counterparts to file lawsuits? Are we going to find a space in which we can both politically and a legal perspective hold the US government accountable? The second aspect to this, and what many have now said is the opportunity we want to look at, is the fact that our governments owe us a responsibility and an obligation to provide the right to health. So as a Kenyan citizen, there's an obligation my government has to provide for me. And so the conversation then comes, what is my government actually doing to safeguard me in the absence of a foreign partner who's been supporting them walking away? And so that's the other level of conversation we need to have, which touches still on human rights and the obligations government has. And so we have a pending judgment in Kenya around looking at what happens when this disruption in supply of ARVs, who's responsible in ensuring children don't miss out on ARVs. And so hopefully our courts give direction on that, which arose during COVID, that will be helpful. The third aspect, and specifically to the key and marginalized populations, we've seen that the current government in the US has been clear that there are certain populations, such as the trans people, who may not be able to get services because of the belief of the government and their pronunciation that there are only two genders. The question then begs that both for funding from the US and also funding from national governments, because there are also national governments that have laws that criminalize men who have sex with men, drug users, sex workers, and would ordinarily not fund human rights organizations to be able to hold them accountable. What happens to that kind of funding, say, that was coming from USAID or PEPFAR to help groups understand issues of HIV, help them safeguard themselves from arrests, provide counseling in cases of gender-based violence that they face during their day-to-day work? What then happens to that pocket of work that will not either be picked up by the US government now and is unlikely to be picked up by national government? So we're in a situation where there are a number of conversations that really need to happen, but I think these conversations need to happen in a way that we now start taking conclusive direction and pushing a civil society or those who are living and affected by HIV in a manner that is now steadfast, resilient, and seeking solutions, or asking the right questions and driving a debate that will help us move from one point to another, because we wouldn't want to find ourselves in a similar situation. Come another government in Canada, in the US, in the UK, we need to find a clear pathway around this. And this is the opportunity to keep pushing those hard conversations. Back to you, Solange.
Thanks, Allan. Raised some really important points there. And I think the point you made about the right to health and putting it back, that question back to national governments is always a critical one. But the quality of the health that we receive is always questionable. And to what extent these things actually have teeth, and who has the energy to now pursue all these legal things while the house is on fire. I think that's what we're grappling with. Yeah, so maybe we can go to Veriano, to the human rights aspect as well, and an activist, a long time well known in the field also for your work on intellectual property. So Beriano, maybe I can ask you, as an activist in the community, how do we move beyond like the emergency responses and the short-term solutions that were coming up, sort of reactionary, to building lasting community-led systems that guarantee uninterrupted access to life-saving treatment? Because that's what people are facing right now. And I'm also trying to read the chat at the same time, but the immediate need is access to treatment, no matter what happens with international funding. What do you think there? Sorry for not asking my question in Portuguese. Let's just say that.
Well, I prepared some points to bring here. I wrote those points because of my English, so I could better organize my mind and probably make things clearer, no? And my name is Veriano Terto. I come from Brazil. I am based in Rio de Janeiro. I am current vice president of ABIA, and I've been on AIDS activism since 1989. So it's about 36 years already. And so I'll bring some points based on Brazilian history and my own history as an activist to try to build a fair public system in Brazil. But I would like first to thank the ITPC for organizing this meeting and to thanks for the invitation. And so my points are based on this recent Brazilian society experience on activism on public health, especially on AIDS activism. I think it's important nowadays to rescue some lessons from the past. For instance, especially from some developing countries, like Brazil. Brazil built a public health system that so far works and guarantees universal access to ARVs and other drugs for for about 1 million of HIV people in Brazil at this moment, as well as for other diseases like TB. This public health system is based on universality and social justice and equity and social and community participation. So this public health system poses health as a collective issue. And in our constitution from 1988, health is a responsibility of the state. This is very important because poses health as a human right. It's a right and it's a duty for the government and a right for the people. No, it's a little bit different of other Latin American constitutions that pose health as an individual issue. No? So but I think that on the last years, I see that some of these principles, social justice, universality, equity, they were abandoned by funders, by governments, even the progressive, by health professionals, and they were replaced by a very technicist and fragmented individualistic perspective of health. No? And it's like a health problem could be solved by a technical short-term solution, like for instance, a medicine or a vaccine. And in our developing countries, we know that it doesn't work so easy, no? So that vision, that fragmented vision and technicist vision of health have been producing fragmentation, no, and weakened all collective perspective of health. So it's important to discuss that nowadays and to bring and reflect on the lessons from the past of what we've been doing, what we've been achieving, especially in terms of activism and collective responses to help guide us in these current challenges that we are living in. No?
Yeah.
And so, because I think that what we are living now is not only a withdrawal of funds or suspension of programs of assistance, but it is an attack on the principles and the politics based on solidarity, universality, equity, social justice, and community participation. So it's time for us again, in our actions, in our capacity building programs, in our organization that Krista mentioned in the beginning, to organize ourselves, that we reaffirm politics. Health is a political issue. I think it is. We got so far good results in Brazil and with the AIDS experiences because this, in addition and together with scientific evidence, we also showed that health is a human rights and political issue. Without that conjunction, this articulation, it would be impossible. So in avoid those only technical or fragmented solutions on health. No? Bring back again intersectoriality and solidarity, and organized around our common principles of seeing health and life as fundamental human rights. No, this is what I would say at this moment in my 10 minutes. Thank you very much.
You'll get a chance to speak again. Thanks, Mariano. And I really love that you bring up intersectionality, which is really critical at this point and maybe helps us to move along to Harpinda, who is probably less well known to this audience. Pin has been working in development financing, and your expertise here, I think, is quite relevant given what we're talking about. So the exposed fragility is clear. I guess the question to ask is, what is the most promising alternative? So in one sense, we can say, okay, the US is not helping anymore. Let's find somebody else. Let's replace, right? So it comes back to the question that was in the reflective situation slides. So can we get another country? I mean, I could name other countries that might want to take on that lead, but is that what we want to do? Replace one head with another? And is this an opportunity? Like, is there other promising alternative financing models that can fundamentally shift the global health landscape and our issue of donor dependency?
Thank you, Solange, and thank you so much for inviting me to be part of this discussion. I mean, we've started off very much laying out the sobering environment that we're in. And I think what's interesting is the belligerent way in which the US has gone about changing the landscape overnight, literally from where we were this time last week on Wednesday to where we are now. It's devastating what they've done. And I think particularly for the global health community, it's such a belligerent and aggressive action simply because the US is the largest funder of global health in the world, right? What we're talking about, global health funding alone is around 34, last data point that I've got, that is a valid verified data point, it was in 2022. And at that point, the global funding programs were at around $34 billion of annual expenditure coming from a number of donors. The US provided 46% of that funding. So, you know, at the end of the day, you've got the US providing such a significant contribution to global health. And then the second largest donor after the US there is Germany, but it's providing a mere 4 billion in comparison to what the US is providing, which is 15 billion, right? So to your first point about, can another donor fill this gap? I'm afraid the answer is no. I mean, even if we look at official development cooperation, and in the wider sense, we've got 32 global donors, but again, the US is the largest global donor on development cooperation holistically. And it's always been the funding that goes to, it provides the biggest chunk of funding, particularly to global health. It's its largest portfolio. And so there aren't any other donors that we can quickly grapple towards and say, no, you need to fill this gap. I mean, and I want to say this with a caveat that although the US is providing in volumes a huge amount of funding, actually as a percentage of its wealth, of its gross national income, GNI, it's only 0.24%. It's insignificant, right, in the wider scheme of the US budget. And that's why this current action is even more shocking and more belligerent, because this is not really about saving money. This is about ideology. And so that's just sort of more of an emotional point to make, that there is a lot going on here that is much more about ideology as opposed to economics. And it's also about demonstrating priorities to an electorate in the US. So it's very much about playing to a domestic base as well. So your question around how can we look for opportunities and other ways of doing things. I've been talking to a number of people over in Europe. I myself sit in Europe. And I've been having conversations with the Commission, looking at other big donors in Europe. And as you all know, Europe is not in an economically in a fantastic place itself. It's shoring up Ukraine, but also there's a lot of significant shifts going on with Germany, France, Netherlands, all making the point that they are going to also be cutting their aid as well. So we're not looking at a rosy scene where there are a coalition of other donors who are fighting to step in and fill that gap. But what they are saying is we need to prioritize. We need to prioritize. We need to look at what can we do that's going to be high impact. It's going to be effective, but we also need to look at efficiencies in other places. And I think there will be a lot of work going on to understand how can other donors fill some of the immediate gaps, particularly around life-saving programs. Again, how do we define what's life-saving? It's going to be hugely controversial, right? At the end of the day, one life saved today, is that better than 10 lives saved tomorrow? So where do we put the funding with regards to programming? So that again is going to be a bit of a challenge, but we are seeing some of the big philanthropists. We already saw Bloomberg, Philanthropies Bloomberg, the former mayor of New York, step in and say he's going to put more effort behind climate. Are we seeing something similar coming up by some of the big philanthropists? And I think a number of my colleagues on this panel have already mentioned the role of the nation state. I think this really brings up the issue of what's the responsibility of government. And it's great to see leaders saying, such as Ramaphosa, saying, we're not going to go out with a begging bowl, but they need to now step in and step up. Absolutely. At the national level. I think that's fundamental, first and foremost. What are African leaders who are like Ramaphosa actually going to do? Are we going to see actions followed by the words of the last few days? So that's number one. But number two, I think we've also got to really look at how we challenge the system. I'll be honest with you, you and I, Solange, have been in so many conversations over the last years where we're all saying, oh, this the aid methodology, the aid agenda, the way we do aid is now so outdated. It's basically a very top-down way of delivering services. It doesn't take into consideration the needs and the voices of the communities. It's also very colonial. It's a very colonial framing of how the North has more money, it gives to the South. There's a bit of a charity element to it, but it's also the choice is very much by the donor. They decide what they fund, how they fund it. It's a soft power tool for them. It's not necessarily going to where the need is the greatest. There's a lot of other political decisions that inform where a country's aid program decides to spend its money, what locations, what topics, which organizations they decide to fund as well. So it's highly politicized, and it definitely isn't reflective of the need that is there in the community. So this is an opportunity, but it's going to be an opportunity that does come at the consequence of a number of organizations. Many of them will be local, will unfortunately not be able to weather such a shock as we've seen over the last week and will continue to see over the next few months. And secondly, we will also see some of the most marginalized communities who are going to basically fall off the priority list for the nation states, and other donors just won't be able to reach them. So there is going to be that collateral damage, which is horrifying for us all. But from where I sit, I've recently just taken on the role of interim executive director of the Global Public Investment Network. And, you know, we're really trying to think through, where's the opportunity here? We need a new system that is much more inclusive. It's much more universal. There's equality and equity in the way that decisions are made. This isn't about 5 donors sitting somewhere else making decisions for the rest of the world, right? So I think there is a real opportunity for us to bring in the governance approach that we talk about at Global Public Investment, about all contribute, all benefit, and all decide. And that's very much about, even if I put $200 in, that means that I am invested, and I have a voice, and I can actually take funding out of a fund as well. So there's that the equality in which that brings the international financing structure is really critical for us for the future. So there are opportunities for us to actually lay some big ideas and new ways of doing things on the table. And maybe we'll have time to come back to that, because I'd love to talk a little bit more about actually how do we do that? Because I think we need voices. We need voices. We need a collective push, but also that push to be coming from the places that are most affected by these rather belligerent actions of this last week. So
Yeah.
I'll stop there.
No, I mean, I just wish we had more time. If I set this up, I would have done 90 minutes instead of 60. But I just wanted to say that, oh, sorry, Krista, did you want to say something?
I do want to step in briefly with moderator's privileges here. We only have 15 minutes left. So Solange, I do want to give you a chance to look at some of the questions that have been consolidated and sent to you.
I've seen.
Also for the panelists, you can answer questions directly in the Q&A just by writing. And for all of you on the call, there's a treasure trove right now in the chat of not only other colleagues, but resources, briefings, other opportunities to engage. So please do see that. Back to you, Solange.
Thanks, Krista, super helpful. Look, I think the question of, you narrowed it down to like its priorities. So what's sort of last in, first out, and how things get chopped. But it brings us back to the point of who is setting the priority, and are communities that are directly affected involved in those decision making, right? You can think about that on the sort of a macro level between countries or among countries, but then within a country, are community voices actually making it up to the national level for those decisions to be made? And so are we going to have one new superpower? Are we going to have the battle of the oligarchs because the rich people are now coming to save us and then they'll decide what the priorities are? Or is this an actual opportunity to build something that works for majority world? Isn't that what they say now? So it's interesting, and I'd love to hear from you guys. So maybe I'll just close with one last question. So 2 points here on the questions, and bear with me. So we're talking about global health, but we're contextualizing it in the geopolitical space, right? So it's a soft power tool. Essentially, the US has used that often to make sure that they have power over China. I mean, let's just say what it is, right? So do we accept that global health always has been transactional in that way? Because every ambassador that I've seen says global health diplomacy, something with diplomacy where global health is a tool. It's not necessarily out of the goodness of their heart and this moral obligation, although sometimes that's how they lead with that. And how do we reshape the power dynamics so that communities rather than political agendas dictate? What is it that we need to do in that context? And then the final question, so that's Linda-Gail, you could just answer that in like 30 seconds. And then the final question, we know that we have to push back. That's a given. I don't think anybody on this call, I'm not sure how many other people are listening, we are going to push back in some form. Everybody will do it in their own way, in their own context. But what is the most ambitious, transformative idea that we are not talking about, that we should be talking about? And can you tell us what that is to reclaim the power in global health? Okay, there we go. And over to you.
I'll try and quickly pick up and agree with you, Solange, that I do think global health has been incredibly transactional. And it has crossed my mind that the current US administration, I think, thinks transactionally. I think that has been their approach. And so I'm wondering, and I hear you, that too often the relationship, the last 20 years of the PEPFAR relationship has been one of the donor kind of approach rather than a partnership where community sets priorities and their voices are heard and the relevant needs of the community are met. I wonder, though, in order, particularly at the current level, that transactional agreement is what needs to be done in order to get the support. But then community in partnership with the national government has a real relationship where this goes beyond the transactional. So I'm sort of trying to say, can we have our cake and eat it? Because I honestly don't know if we can really get away from the transit. The best arrangements I know are win-win relationships, right? And so how do we work that? And maybe that is the new idea, that we work the transactional element so it works for everyone. But then beyond that, there is agreement. Maybe it's the terms of the transactionality that community has a real say at the end of the day.
Yeah, thank you. Agreed. Others, I don't want to speak too much. Others
Sure,
want to hear from.
I think I'll speak to the reshape power dynamics, and for me, it goes back to holding our leaders accountable. We have elected various leaders nationally to represent us, and I think for us at the national level, we have to go back to our parliamentarians and those in power and say, you have an obligation to ensure we enjoy the right to health. What are you doing around about it? And how do we begin to have those hard conversations? But also directing them in terms of if they're going to go back into a renegotiation with PEPFAR, with USAID, with the US government, these are some of the things we'd want to have on the table. It's guaranteed that we have seen that global funding for health has continued to dwindle. We have had conversations on sustainability, but I think this is providing an opportunity for us to have a franker conversation. And I think for me, the difficulty I have is that there's a gray area that no one is going to touch, and that is funding the things that make donors, pharma, governments uncomfortable. And that's the gray area where I would want to call upon private philanthropists to think through how will they step up, because governments need to be held accountable for inefficiencies, for corruption, for things that make money not go to what it's doing. Donors need to be held accountable for the commitments they make, but not many of them may be willing to fund that directly, especially with the government in hand. So my clarion call is that the private philanthropists need to step up. If they've only been funding treatment and care, they need to think through this is the time to shift and see who's going to play the accountability role. And we can only do this by having our collective power, writing the letters we're writing, calling our legislative members. I've seen it happening with colleagues in the US, calling their Congress people, holding them to account and pushing them, because at the end of the day, they listen to the people who vote for them and try to align to what needs to happen. And so that's the only way for us to organize. But most importantly, we must realize the things we care about as civil society are likely to be the things that will not get funded, even when the governments agree on how to continue or how to move forward, or even if governments take over aspects of the health system or HIV system. And so we must be really keen to that. Quality of service young people are used to get, quality of service gay people are used to getting, and trying to ensure that there's no breakdown in that. And so for me, that's my call. We really have to push for those gray areas to be supported by private philanthropists. Oh.
Thanks, Allan. So within 4 minutes now, so 2 for you, Veriana, 2 for you, Pin.
Okay.
Go
you go.
Me? Okay. Just to, I think that we have 2 big challenges. I think that we must organize again ourselves now as a social movement, an international social movement, around some common principles and issues that we must identify. It is human rights, it is, I don't know, life-saving, no? And the other point is to break isolation. I think it's time to look for alliances, to build alliances with other social movements of other areas that are also being affected by those measures. So health, it doesn't exist itself. And that message must be brought to the funders as well, because funders are saying, well, my agency is not funding health anymore. It's not a matter only of funding health. It's a matter of defending democracy, is defending life, is defending justice, is defending equity. This is what we are talking about. If we implement ourselves and saying health as an issue that only health is being affected, I think will not succeed. We did that in the past when we showed that health is a human right issue, when we're talking not only on medicines and prevention and treatment and this, but we are really talking about life, about democracy, about access, about dignity. It worked in one time, but we've been losing that. Okay, last year in Munich, I was amazed. I was struck. Solange was there. We were in a round table to celebrate 40 years of this community response on AIDS. My two other colleagues only talked about their current work in their organizations. So a social movement without a memory, without a history, without affirmation of principles, okay, it's impossible. You see, those people, they are organized those attacks on very clear political issues that they have, the extreme right. So it's not a technical, it's not funding itself. It's much more than that. So it's a time to call for action. It's time for union. It's time for alliances and to reinforce and bring again solidarity. This is what I would like to say.
Thanks, Marianne. Yeah, a social movement without a memory. What is that? I agree. Good point.
Okay, quick point. I agree with so much of what others have said. So the extra piece that I would add is accountability. Right? There's got to be better accountability to donors, to the people at the end of the day that are at the end of the chain who are receiving the benefits of these programs, right? Because at the end of the day, accountability comes back to the taxpayer of the country rather than the people who are benefiting from the programs. And I think that, to me, I really struggle with that. And I think there needs to be greater accountability, especially as we look towards philanthropists. Who are they accountable to, right? And I worry about that. I worry about who's going to step in and fill this gap, and actually whether they have a strong sense of accountability. So for me, then we have to build a new system that puts accountability to the communities at the center. And that accountability, we have governments, but where they are elected, there's some form of accountability, but where they are not, how do you enforce that accountability? So accountability has to be really at the core of that. And secondly, I would also add that we need more and better public finance, right? At the moment, ODA, this volume of aid money, as we call it, it's $223 billion per year. It's 32 countries. It's 32 countries. When it started off, in 1960, it was 20 countries. So it has grown to 32, and there's countries like Slovenia, Czechoslovakia, countries who used to be recipients of aid who are now providing development cooperation. How do we turn this from being from 32 countries to 191 countries? Because all of a sudden, public finance becomes significant. It becomes a big volume. It doesn't need to be billions that they're contributing. Even if it's a small contribution of $1 million each, right? You start to see public finance actually taking shape. And the point with regards to that I'd like to make is what sits where? What's the role of public finance at the national level? What's the role of public finance at the regional level? And what's the role of public finance at the global level? At the moment, we're seeing a lot of global public finance doing the role of what national public finance should be doing. And we really need to be very clear about that. Global should be about tackling issues that only the global community together collaboratively can tackle. And I think we, sorry?
I need to cut you off there.
Oh, I'm sorry.
Look, I think what I wanted to say is that we wish we had more time. We're probably just going to go 2 or 3 minutes over the 6:30 mark, but I just wanted to maybe that's your point is profound because the global should be doing what the global should be doing. And it begs back the question, what's happening at the domestic stage and then even at the regional space, which we haven't touched on. So hopefully we can have a second part of this webinar where it's 90 minutes and all the questions that came through would be answered and we can have a little more of discussion time rather than feeling like we're sweating and rushing through everything. We do want to make sure that we put up a slide that Crystal will walk us through, which just helps us to make sure we're connected to others. And then I'll just say 1 or 2 words and we can close. I don't really mean to cut off anyone, but we have to respect time and I'm already going to be 2 minutes over.
Yes,
Over to you.
thanks very much. Gloria, if you could move us to the final slide. It's the fish again. I just wanted to thank everybody, especially the panelists, for taking their time to be with us in dialogue today. All of you on the chat, we're seeing folks across academia, science, implementation, civil society, key populations. We really appreciate you. Please stay in touch. So we do want to have further webinars. Follow us on social media. There are several very active civil society advocacy working groups. You may be aware of some of them, the Health Impact Coalition, the Change Initiative. We do want to protect the safety of some of those participants there. It's a work in action. So we think the safest way to do this, rather than just posting an open link that could go anywhere, is please email us if you want to be connected to that. So send an email to admin@itpcglobal.org. We are learning as we go, as evidenced by the fact that my WhatsApp notifications went off for half of this webinar before I realized I had to turn them off. So next time we'll have more time. We are going to find a way to address the open questions that remain in the Q&A box. I'm not exactly sure how we will do that, but we'll find a way and get it to you. As well as I recognize there are some raised hands right now amongst the group. I apologize we weren't able to get to you. We will do a better job next time. And finally, back over to Solange. Thanks, everybody.
And as we're doing this in our own ITPC, we're able to reverse the slides now. But really the point is that they want you scattered and the focus is our resistance. Look, our goal today was not to analyze the crisis. There are many groups doing that and giving you updates that are point by point and you can get all the details. It was really to remind ourselves of what we're fighting for and kind of take a human step backwards. So maybe you can just go to the next slide. Beyond the urgency of today, what is the long-term goal? What kind of global health system are we trying to build? And if we keep that vision at the center of us, we will be able to not just respond to this moment, but really shape or reshape the future. Look, ITPC was born in crisis. Many organizations on this webinar that are our friends here were born out of crisis. And so we have that in our DNA. We took a stand. We said that health is a human right and no one will be left behind, not on our watch. So we are really happy that you were able to join us. We are not powerless. We are not alone, and we're going to fight for the sustainable goal of health together. And we're not the ones that are victims of what's happening, but we are the ones shaping what comes next. So thank you very much, everyone, and stay tuned for part B. Thanks, everyone. Bye-bye.
Thank you. Goodbye.
Thank you.